Hi, I'm Alexia Oliver and I'm 23 years old and a 6th year medical student, and I had cancer. I was diagnosed with lymphoma in February 2018, which was the beginning of this year. And actually how I got diagnosed is quite weird. I'd had all the B symptoms. So the B symptoms of a lymphoma are things like fatigue and sweating, temperature, and something called pruritus, which is itchiness all over, which is really quite unpleasant. So I had all those symptoms and everyone just thought I had flu, and I kept getting antibiotics. And then I took something called Tamiflu, which is antiviral. But yeah, I just kept getting treated in different ways until my head started swelling up. And it just got bigger and bigger until it looked like I'd been stung by 1,000 bees. And it was just really unattractive. And I actually won't forget that one morning I was post-call and I was sleeping, and obviously I sat up for the first time. And when you lie down, your head gets bigger, and when you sit up, gravity helps and it drains the blood, so your head shrinks. So I'd just woken up and I went to chat to my best friend, and she straight up said to me, "Girl, you cannot come to this tutorial. You're just too ugly. You need to go home." I thought that was brutal, but it turns out she was onto something. So I went home. I drove back from Barra somehow, and I got home in one piece that day. I did a number of calls, and during these calls I was going blind, and I was getting headaches, and obviously my face was swelling up. And I was doing gynae at Barra, which was a lot of running around, like running to the blood bank and stuff, and it's really quite a physically intensive block. And one of my other best friends, I was on call with her, and she ended up driving me to the neuro department at Barra to get Tramoset because I was going blind and I had terrible headaches, so we thought it was a migraine. And yeah, it started deteriorating, and then I started getting lower teeth pain, like over here. And I thought all my lower teeth were going to fall out, and I was really worried, so it would not be very hot. And then I organized a visit to the dentist. Went to the dentist, and he diagnosed me with lockjaw and sent me to a maxillofacial surgeon, who also diagnosed me with lockjaw and tried to fix it and said that was the reason for all my facial swelling. And after that, the swelling just didn't go. We fixed the lockjaw. I got treated for an ear infection and basically got told to exercise by quite a few people because I was getting fatter. Very rude. But yeah, eventually I ended up at a physician who saw me on a Tuesday afternoon, did an examination, which involved a lot of like poking around here, which was kind of gross, and weirded me out a little bit because I had no idea what that was for. But he organized a CT scan for the following day, and I went into Morningside Clinic and I had my CT scan, and it turned out that there was a massive lymphoma sitting in my superior mediastinum, which is, you have your heart and then you have the little thing above your heart, and that's where it was. And it was wrapped around my superior vena cava, which is the big vein coming back from your body to your heart. And it was wrapped around my aorta, which is the big artery going from your heart to the rest of your body. So it was basically compressing everything and all the blood flow, hence why my head was getting bigger and bigger. So we did the CT scan. It was diagnosed as possibly a lymphoma. And then we did a biopsy through this lovely scar over here. And I was diagnosed with a large diffuse B-cell lymphoma, non-Hodgkins, and thereon I was admitted to hospital and did not leave for a month and 2 days. First month was very shit, but I was also mostly not really conscious because I had so much blood in my head that everything was like congested, and I was on so much cortisone. They had to delay my chemo because I chose to have the egg harvesting procedure so I could have babies in future. I'm not sure how I feel about now. It was a really horrible experience. Yeah, and then the first chemo, I actually had a terrible reaction. I got something called tumor lysis syndrome, which is when your tumor basically pops. And I exploded into 800 chins, and everyone called me Jabba the Hutt because I got really, really, really large. I was very unattractive, and I froze my boyfriend he came to see me and everything was too hot, so I put the aircon on to like -6. So he was wearing my dressing gowns and he was holding my hand, but he was only allowed to hold that part of my hand. That's it, nothing more. Yeah, and that knocked me out for about 3 days. They thought I was going to lose my airway and they thought they might have to ventilate me, but in the end that didn't happen, which is really good. I did have to have oxygen, which got tighter and tighter as the day went by, and it looked like I was being strangled. My mom was very concerned. And made it through that round of chemo by the skin of my teeth, and eventually got home, I think 2 weeks afterwards. And then I had 2 weeks of home, and then I had the next round of chemo. And that shit is just brutal. It just destroys you. So, yeah. Every round of chemo brought its own pleasant surprises. It's quite interesting though. You can have like a side effect. So, for example, heartburn you can have for 1 day. One day you'll have the worst heartburn of your life ever. And then the next day it'll be gone. And you won't have done anything to fix it. It'll just... So, yeah. I have to drink water. Dry mouth is one of the side effects. But round 6 of chemo was possibly the worst thing I'd ever experienced in my whole life. I felt like I was going to die. I'd often felt like I was going to die, but this one was like, I'm gonna die. I remember lying on my bed, this bed, and I was lying sideways, and it was raining outside. But it was like that sunny rain, and I was looking at the rain outside, and I was just crying from this eye into that eye, and out onto the bed. I just stayed like that for a whole afternoon. It was so depressing. That was definitely one of the hardest. Around 7 and 8 came and went, but one of the fantastic side effects of one of the drugs I was on is cardiotoxicity, and I ended up going into heart failure as a result of the chemo. So that opened up a whole new door of challenges, because when your chemo is finished, you're meant to feel better and better, you're meant to feel more strong, you're meant to get back into your life. But yeah, that just didn't happen. I got worse and felt worse, and eventually the boyfriend and I went for brunch, and we came home and we were chilling, and I just stopped breathing. Like, I started crackling and bubbling, and he was like, what are these 10 reasons for it? Whips out his phone and Googles everything, as he does. And I was like, no, it's pulmonary edema. But I didn't want it to be pulmonary edema, because pulmonary edema means that I was in left-sided heart failure, which is not something you really ask for. So I ignored it for like 2 days. Then I went to a cardiologist, and my ejection fraction, which is how much blood your left ventricle of your heart can push out. It's meant to be above 75 for most healthy people, but mine was 26, which is really bad. So my left ventricle wasn't working, and the blood that was meant to be pumping out of it was pumping back into my lungs, essentially, and filling them up with fluid. So I was drowning on land. That really didn't feel very good. And then I had chest pain, and I went to a cardiologist a few times. He eventually admitted me to high care, ACU, where I stayed for 4 days over the long weekend. Missed out on all the fun. That I probably couldn't have had anyway. But yeah, stayed there for 4 days. They tried to stabilize me. It kind of worked. I ended up going home, and then on the Monday, and then on the Wednesday, my cardiologist organized for me to meet the transplant team of South Africa, which is quite a hectic thing to do, because I didn't really think I was on the transplant track. But I went to Mill Park Hospital, went to go meet them, and I was only going for the day in my head. I didn't take any clothes, I didn't take a toothbrush. I was like, no, I'm going in and I'm leaving. And I ended up being admitted to their ICU, their cardiothoracic ICU. And I stayed there for 12 days, which was the worst possible experience I can think of, and I still have PTSD from it. Initially, they were taking my potassium every 4 hours, which is a blood test. They were doing blood tests on me every 4 hours for the first 8 days. And I got to a point where I was like, no, you can't. And all the phlebs were like, you can't say no. And I was like, well, I'm saying no. So it was just a horrible experience in general. But I did make it out eventually, and I got home, and that's really cool. This whole week this thing was looming, and that's something called a CT PET scan, and I'm sure everyone kind of knows what that is, but it's a scan that they inject you with a radioactive isotope, which has got some glucose in it. And then the cells that are working really hard in your body and dividing really quickly, they suck up the glucose, and then because it's radioactive and it's like a marker, when they do a scan, those bits light up, and they're called hot areas. So they can show whether or not you have actively dividing cells and therefore actively metastasizing cells or malignant cells. So this scan basically tells you whether or not you have cancer, or still have cancer, or whether or not you've responded to treatment. So the scan was today, and it's quite a scary thing. There's something that's associated with scans that cancer patients like to call scanxiety, because you can't think about anything else. You just think about the scan, how the scan is going to determine your life and what's going to show in the scan and how you're going to feel about the scan and where to go from here. And also, if one scan's clear, that doesn't mean the next scan is clear. So you're like, remission, yay, but what about the next 6 months? You never trust the scan. So went this morning, and it was interesting. What they do is they make you sit in a dark room with in this big lounger with lots of comfy blankets, and they inject you with the radioactive isotope, and then they leave you for an hour and a half by yourself, doing nothing in the dark. So luckily I was very tired because I've had the joys of suffering from a tummy bug this week, so I didn't sleep last night. But so I could sleep in my chair, but a lot of people say that they just feel the seconds ticking by and there's nothing they can do. You're not allowed to read because reading causes eye movement, and that makes your eye muscles work, and therefore your eye cells take up glucose and the radioactive isotope, and they think you have eye cancer. So not a good plan. Can't listen to music for the same reason. You literally have to blub in your anxiety. So that was fine because I managed to fall asleep. And then you go to the CT PET scan, which is basically a CT machine, which is one of those big donut looking machines. It's like thing that slides in and out. You lie in the thingy and they strap you down because you can't move. So they put a strap on your forehead, and they put a strap on your chin, and they put a strap over your arms so you're in like a straitjacket. And they scan you for 45 minutes and you can't breathe, and it's horrible. But I did it. I was like, there are two ways I'm getting out of this. I'm either going to smash my head on the CT scan, or I'm just going to explode because I have no other options. But I tried to think of it as a spaceship, and that I was leaving Earth and I was going to be like Captain Alexia. Sounds super lame, but it helped. So yeah. Then I walked out of the scan feeling weird because I'd been lying down, and people in heart failure should not lie flat because their lungs fill up with fluid. And this random doctor popped out of a side wall and he was like, Alexia. I was like, oh, yes, that's me. And he was like, your scan looks good. We just need to do an ultrasound of your gallbladder. But your scan looks very, very good. A complete metabolic response, which I didn't hear because I didn't believe it for a second. My mom burst into tears. My sister was just like, but that was funny. And then we went and did the ultrasound, and I chatted to that same doctor, and I was like, okay, but is it a complete metabolic response? And he explained it all to me, and yeah, it basically means that there are no cells in my body that are currently malignant, which is really cool. So it means there is no cancer. It is gone. To be honest, I haven't really felt a transition. I don't think it's really hit me. I think you're quite numb initially. My first response is someone read it wrong and they need to do it again. But I don't think you can really mess up that kind of stuff. So I don't really believe it. I think I'll believe it when I'm feeling a bit better in general, or it'll take a few days. But it is quite a relief to know that there isn't more chemo coming, because I think that's one of the hardest parts about cancer is the treatment, not necessarily the cancer. The most important lesson that I have learned is probably to endure, and that fighting is not the best way of going about things, Everyone says you have to fight cancer. It's a battle. You have to be a warrior. But I think if you fight, you don't win. I think it's more important to soften to it. You have to endure, you have to soften, you have to be patient with yourself. Because fighting back just burns up your energy and it doesn't get you anywhere. So mentally, you have to fight to keep your sanity. But sometimes you just have to soften to it. You have to accept, you have to take a deep breath in and out. You have to think about where you are and how far you've come. And that you can actually do more because you can endure as a human. Oh, also, cancer patient tip. Don't go to someone's house and expect food if they're a cancer patient. They usually feel nauseous and they're not going to want to feed you. Okay, I'm done. Or don't start a keto diet when your girlfriend is nauseous from chemo and you smell like a dying animal. What I'm looking forward to next is probably recovering from the heart failure. That would be very nice. I don't want a transplant. I don't want a left ventricular assist device, an LVAD. I just kind of want to be capable of going for a walk. Something that I miss the most out of everything, and possibly the only thing that makes me truly emotional, is the fact that I'm not at med school. The fact that all my friends are graduating in 5 weeks' time, and I still have to do the whole year again. And I don't know if I'm going to be able to go back next year because of the heart stuff. So I just want to be a doctor. I've wanted to be a doctor since I was 3, since I knew what doctors were. I don't know. It's just something, it's my calling, it's what I'm meant to be, it's what I'm meant to do. It's everything I've ever wanted. It's so hard not to do. It's so hard to see everyone else doing it and not really appreciating what they have. And just getting to do what I really want. And I really want to help people, but that sounds lame. But I really want to help people, and I really find it very interesting. I love medicine. It gives me warm fuzzies. I love it. Do I want to be all the doctors. I want to be the ultimate doctor with every single specialty. I wanted to do surgery, and I wanted to do pediatric surgery specifically. But I don't know if I still want to do that, because I've seen so much gore and like stuff coming out of myself this year that blood is kind of freaking me out a little bit at the moment. I don't know if that's just because it's mine or if it's because it's blood in general, but I also didn't really appreciate like the magic behind internal medicine. It's very interesting. It's very difficult, and you really have to be quite clever.
You're saying clever.
So, what?
You're saying you have to be clever.
Yeah, you have to be very clever, and I'm very clever, I'll have you know. So yeah, I think I want to be a physician, but then I also want to be a trauma surgeon. I don't want to be, what's obs? I don't want to be an obstetrician or a gynecologist. That's a no. I don't want to do anything to do with eyes. But I want to be a trauma surgeon, a physician, an ICU specialist, a neonatologist, a pediatric surgeon. So what I would tell future Alexia is that it sounds super lame, but it's something that has helped us in the past because there's so many of us, because we have so many personalities. Nothing lasts forever. So the bad stuff doesn't last forever. The good stuff doesn't last forever. So appreciate what you have, but also know that you only have to endure bad stuff for a short time and really enjoy the good stuff. There are lots of things that I want to say, but I can't organize my thoughts. There are too many. We'll have to do a part 2. We can do a heart failure one. Bye. Thank you, Charles. I love you. Charu.